Good evening, viewers. Today we are here together to discuss about a problem which is engulfing the entire world, entire humanity, is about the lifestyle diseases and the role of proper nutrition on the outcome of the kind of problems that we are facing today. So, we are very fortunate to have a very wonderful person, a very knowledgeable and authentic person on this subject to discuss on this thing. My name is Dr. Goswami. I am a general practitioner by profession, and it's really a great opportunity to have this discussion about the role of nutrition and a kind of scientific approach towards the nutrition to influence the lifestyle disorders. So we have our wonderful guest, Dr. Bijoy. Dr. Bijoy, good evening and welcome
Good
to
evening.
this show. I am so honored and to kind of privileged to have you in our show. So, can you please just tell a little bit as to how you, as a clinician, became interested in the subject of nutrition and medical formulations that can influence the humanity in the longer run?
Good evening, Dr. Goswami. The first question which you have asked me, that particularly in case of nutraceutical supplement, why it is required, and second most important point is that how this formulation is made and how it will give the better benefit to the human beings. The first question, straightway I'm coming, that why these nutraceutical supplements are required for taking care of different lifestyle diseases or the prevention of the lifestyle diseases. I would like to tell you, in India, if you see the populations wise, it is world's number one. Now, we do not have the medical facility to that extent that we can give the service to all human beings when they suffer from disease. So, in this case, I would like to tell you the easiest way to prevent the disease. All of us know that prevention is better than cure. So, when we talk about that prevention is better than cure, that's why the nutraceutical supplements, it has come in the picture, and it's basically helps preventing the disease. So that's why, yes, nutraceutical supplements, it has a definite role for preventing the disease. Secondly, I would like to tell you, even also a lot of people, they have a lot of confusion regarding the nutraceutical supplement. This nutraceutical supplement, it has been categorized in three segments. Number one is that only nutraceutical supplements which is preventing the disease. Certain nutraceutical supplement, it comes under FSDU and FSMP category. That is food for special dietary use and food for special medications. In those cases, basically we give this particular supplement where already the person is suffering from a particular disease. And this FSDU category and FSMP category formulation, you will not get these particular formulations available in the market just like that. It will be prescribed by the medical practitioner. But nutraceutical supplement, yes, you will find in the online, even also direct selling, also you will find this nutraceutical supplements. And in such case, I would like to tell you, yes, for preventing the disease, yes, it is required. Second question, you have asked a very good question, then the formulations, how it is being made. I would like to give you one particular example. For example, in case of diabetic patients, generally we have a modern medicine and the patient is being treated with the modern medicine. But how nutraceutical supplement will help in this case and how this particular formulation is being made. Particularly in case of your nutraceutical supplement, if a diabetic patient is confirmed and taking your modern medicine, there this nutraceutical supplement can be given, number one. Number two, the person has not detected as a confirmed diabetic patient, but he is in the borderline or pre-diabetic patient. If you take into consideration fasting blood glucose level within the range of 135 milligram per deciliter, or even postprandial blood glucose level, it comes near to your 150 or 155, just like that. And HB1C level, it is 5.5 to 6. Within this range, it is there. There, actually, the person is not a confirmed diabetic patient, but borderline diabetic patient. If he is not taking care of lifestyle, because already we have told it's a lifestyle disease, then in future he will be a confirmed diabetic patient. So here, generally, initially, we should not put this patient on modern medicine. What we can do, we can give the carbohydrate restricted diet, exercise, and along with that, we can give this supplement. And now, when we are making this supplement, we have to look into three aspects. One is that a person is suffering from diabetes. The reason behind is that the insulin secretion from beta cell has been reduced, or maybe the insulin secretion is quite normal, but it is not being utilized by the body. And third one is that there is no insulin secretion from the beta cells. Now, here what we can do when we are making a nutraceutical supplement, particularly for pre-diabetic patient, even also that can be used in case of confirmed diabetic patient, along with the modern medicine, not as a standalone. Now, in case of your pre-diabetic patient, this particular formulations when we'll make, we have to look into three aspects. One is that there should be an ingredient in these formulations which will stimulate your beta cell to release insulin. Even also, whatever insulin is being released, if a person has a obesity, then this insulin cannot be utilized by the body effectively. That means it cannot bind to insulin receptor. So I have to see that there should be some ingredient in the formulations that will increase the insulin sensitivity. That means whatever insulin will be released from the beta cell, that can be utilized by the body effectively. And the third one is that whatever carbohydrate diet we are taking, after digestion, initially polysaccharide converts into your disaccharide and then monosaccharide. And this monosaccharide, that is glucose, galactose, and fructose, that will be absorbed from the gastrointestinal tract simply. Now, if we can reduce the absorption of this glucose, also the blood sugar level can be taken care of. And now you will find that in case of modern medicine, there is a medication that which will excrete the excess glucose through urine. So these are the aspects we take into consideration, particularly in case of your formulations, which is being developed in the nutraceutical segment. Now, the question is that what are the ingredients that will take care of that? For example, if we take fenugreek, that means fenugreek reduces the absorption of glucose from the gastrointestinal tract. Then Salacia reticulata, which stimulate your beta cell to release insulin. Even you will find that we can add chromium. Chromium basically increases insulin sensitivity. So that way, these sort of formulations, it will be made and it will be very effective for pre-diabetic patient. There, what we can do, we can suggest the patient initially diet and exercise, lifestyle modification, and they can take this supplement. Hopefully, most of the cases we have found that the blood sugar level is being controlled. That means I am not putting the patient on the straight way modern medicine. Yes, if it is not being controlled, then obviously we have to go for drugs. That means modern medicine has to be prescribed. Here also, the nutraceutical supplement has a role. You will say that how? Because he is a confirmed diabetic patient, is taking a modern medicine, that is drug. So how this nutraceutical supplement will help? The nutraceutical supplement will help in a different way. Suppose a patient has a 200 fasting blood glucose level, or maybe postprandial blood glucose level 280. Patient is a obese to type 2 diabetic patient taking insulin secretagogue as well as insulin sensitizer. Insulin secretagogue is, very well, glycoside or glimepiride. It has been given, and metformin as an insulin sensitizer, it has been given. So the patient is taking 2 milligram glimepiride, and metformin he is taking morning and evening 1000 milligram, 1000 milligram. Now, along with that, if I give this nutraceutical supplement, what will happen, then in long run we'll find that in case of 1000 milligram metformin, the patient can take 500 milligram morning and 500 milligram evening. So I can reduce the dosage of this modern medicine. If the modern medicine dosage is being reduced, then the side effects of this modern medicine can be taken care of. All of us know that metformin, if I give for a prolonged period of time, it reduces the absorption of your vitamin B12. If vitamin B12 is not being absorbed in our body, you will agree with me that there will be no proper myelination of neuron, and it may lead to your neuropathy. There will be a problem of nerve conduction velocity as well.
Great. Thank you very much, Dr. Dev, for wonderfully explaining the whole situation that the humankind is facing today because of